My paper is on New Age Technology and Healthcare. Maintaining good health and independence for as long as possible is essential, especially for the aging world population. The elderly do not want to have to rely on anyone to help them with daily activities, including maintaining their health information. With the older adults becoming more technological savvy, as reported by the Pew Research Center in 2014, 74% of older adults owned computers or iPads and 19% owned smartphones. These numbers are sure to grow with the aging population. Now, due to advances in technology, the elderly can live independently and maintain a healthier lifestyle longer than they would if the advances in technology had not occurred. This is a new age for self-monitoring, analysis, and reporting technology, or SMART. This term originated in the computer world by monitoring the hard drive of a computer and protecting and preventing errors that may occur. Technically, it checks the health of the hard drive and lets you know if there are any problems. So, why not have a smart band that you wear on your wrist that would not only monitor vital signs but also your electrocardiogram, glucose, oxygen level, activity, safety, and even help with medication administration and management. Managing a patient in a nursing facility is costlier than if the patient were living independently at home. This type of product could help many of the elderly live a more independent life and a safer one. This product would also be a huge time saver for medical providers and physician offices and hospitals to have accurate medical information on the patients instantly. There are several wearable devices that are currently breaking into the market this year. The devices available can monitor people with asthma, diabetes, heart disease, chronic pain, epilepsy, and several other disease processes. I could not find one that would manage your complete health and information. Having one device that would capture the total well-being of an individual would be the optimal thing to have. Along with this device, software would be available through an app for your smartphone or home computer. With this type of technology comes strict regulation for use from the FDA and other regulatory boards worldwide to make sure that personal information is kept private and that all HIPAA regulations are being met. A current competitor that is on the market comes from Fitbands such as the Fitbit. Fitbit is already being able to monitor vital signs as well as being able to tell activity status. This smart band, along with monitoring vital signs and heart rate patterns, could also be set to notify you when to take medication and record when you did. Also, other medical history information could be kept on the device. The device could be useful in the emergency departments and physician offices where they could download information quickly and accurately to have your medical history faster. Another perk with the smart band would be safety for the patient. The device could detect the patient's position in case they had fallen. It also could help with the less active patients and make sure that they were turning and repositioning off of areas that could cause potential skin breakdown. There also would be an emergency button on the device to activate the emergency medical services in case of a crisis. This smart band could almost take the place of having a home health provider coming into the home to monitor patient. But ultimately, nothing takes the place of hands-on assessment of patients, but this product could come close. Of course, the smart band would be very user-friendly so that the elderly who have not worked with computers before could easily use this product. The cost of the band would be around $400. Even though it is a little pricey, eventually, if all the regulatory and governmental agencies could see the benefit of having such a device, then maybe Medicare and the other insurance companies would pay for the device like they do for durable medical equipment. There was a study in Norway on utilizing modern technology in a smart home setting and did video home visits with the elderly. Even with an initial higher expense of setup in the home, around $4,200, which included internet, computer, camera, and wiring, the study showed a decrease in savings of overall expenses in health care and maintenance for the elderly. It showed lower readmission rates to the hospitals and shorter lengths of stay. When they substituted a physical visit with a video visit, they saved an average of $53 per visit. But the big savings were being able to keep the elderly in their home longer, which ultimately saved an average of $65,000 per patient per year. So if the patients had a smart band along with the video home visit, this savings could potentially be even more. Implementing such a new product would be fairly easy. Most physician offices and hospitals already have electronic medical records, or EMRs. The smart band would need to be compatible or have the link that would make it compatible with most EMRs. The biggest setup would be the education and making sure that the elderly understood how to use the band, and education for the medical staff to be able to download the patient's information from the band. There would be no major policy changes within the facilities and accepted the smart band. it would have already gone through all the regulatory measures to make sure that all areas of HIPAA were compliant. Regular data would be measured through the app, and this process would have been disclosed, and the use of the data measure efficiency of the product and the ease of use. This information would be collected for feedback purposes only. Surveys would also be used to measure the efficiency of the product. Marketing would be first at the physician's offices. This way, the physicians could educate the patients and evaluate which patient would benefit from this product most, but it would also be available for any patient that wanted to utilize it. Then the marketing would be pushed to the general public through television, print, and radio, showing the benefits of being able to decrease the chances of being hospitalized by catching problems or concerns early with patients, as well as the safety features of knowing you could call for help when you were alone, would be a great selling point not only for the patient, but for the family members. Being able to utilize technology to improve your health as well as your safety and independence is a huge bonus in this day and age. Thank you so much for your time.